Okay, assalamu alaikum. Today we're going to talk about veneers, and one of the things we were discussing is how do we reach to a point where we can merge all the digital technology that we have now, up to the point where you can have a prosthesis based on treatment planning and diagnosis and different treatment options, where you can finalize it as a mock-up or a temporary restoration for the patient to visualize and approve. Okay, what I'm looking for actually, I'm not aware of the dental systems that are available, because I've seen some on the YouTube and I'll show you some that I've received as images. But the idea is what I'm looking for, and I want maybe the help on people on the net to give me. I want some system where they can merge smile design. And why do I need this smile design? Because I want to make my restoration called prosthetically driven. What is prosthetically driven? Driven. Okay. What happened even earlier, that's many times that who places the implant is not aware of the prosthetic treatment that will happen later on. So what will happen? They will open this gingiva, open the bone. Maybe they'll see the CBCT before, but the idea they will place the implant in their ideal position and in terms of bone volume and the morphology, and they will not be taking in account where is the position of the restoration going to be. For prosthetically driven prosthetically driven restorations or implants or whatever they are, they mean they are putting the implant in the favorable position for the prosthetic part, not for the bone part. Yeah, and you allow the bone to follow your ideal position by augmentation procedures. Augmentation procedures by themselves are limited, so sometimes the augmentation procedures can provide me with sufficient bone. Sometimes they're not, so I have a limit in how much bone I could add, and you can refer to oral surgery books that you can. And then I have another limit of soft tissue that I can add. I could add connective tissue grafts and so on. I could add a bit more vertical dimension by soft tissue grafts, and then I will need some extra spaces sometimes that I could not substitute by bone and soft tissue. I need sometimes to add pink porcelain. Okay, so I'm changing my restoration to have other than the crown also to replace the soft tissue. And wherever I'm replacing soft tissue, that means it could be fixed as pink porcelain, or it could be removable by acrylic base. Okay, so I'm replacing bone and soft tissue. So what I mean by prosthetically driven, meaning that I am placing my implants or my procedures in a place favorable to the final aesthetic result. This is where the smile design comes in, that the best aesthetic result we could get, we get it from the smile design, and we follow all of our procedures, preparing the area in the surgical or operative area that we're working on to meet this smile design. So it's called prosthetically driven. And it gives a lot of attention to the tooth morphology, the final tooth morphology. It's very important now in aesthetic dentistry, and it also takes into account the gingival morphology. It's not only the tooth, it also takes into account the gingival morphology. So this is what I'm looking for. I'm looking for this, but we have already the technology where we have the CBCT, okay, where we see the 3D view of the bone, because most of the smile designs I'm talking about are 2D only, okay? We have the CBCT that gives me a 3D image of the bone alone, doesn't give me a lot of soft tissue things. And then we get the digital procedures of the CAD/CAM, okay, where I design using the computer my final prosthesis, or our temporary even, if I want to try them, and I mill them as well. So what I'm looking for is actually something combining these. I want a system, an electronic system or a digital flow system that combines the smile design with the CBCT, with the CAD/CAM milling procedures. I need the milling part of the CAD/CAM, so I need to mill. So I'm doing all of this electronically. I'm not aware of any system. I will show you some of the systems that I found. I found this system on the YouTube. okay, it talks about they are taking the full the photography, and they're making even let me go earlier a bit. They're making some scan of the face. Okay, you have intraoral images, the image, and they are overlapping the images on the CBCT. Okay, they're taking other. They're telling you about other types of system. This is the smile design part of it. Okay, so you're doing the smile design as you know it, and then they're reaching a point. Now this is where the gap is. They're reaching the point where they have designed the full. They have not put here what are the technology they're doing. How did they move from the smile design and the CBCT up to the full milled or manufactured prosthesis? So this is one. The other one, if you can open the image, please. The other system that I found also was another 2D image. Okay, we're looking at a 2D image of smile design. This was done on a cast, and now this is the image overlapped on the CBCT. So looking at this, while they are doing the treatment plan, they are measuring the volume of soft tissue that needs to be replaced. So they're comparing it in terms of if I'm going to place implants, where are the ideal position of implants to meet these requirements? Maybe they found that there is a lot of bone that needs to be added. Maybe this is limited in surgical procedures. It could be limited. So they went for another design. So no, it doesn't work with implants. So we have to go for bridges and porcelain coverage of the graft area, because we cannot graft this amount of bone. Maybe in their limited facilities, maybe other facilities have better augmentation procedures. So, but the idea here is that look how the smile design, the 2D smile design, is overlapped over the CBCT, and it's guiding the planning. And you also see the amount of soft tissue you need to add. Not only the bone you need to add, but also the soft tissue that you need to add. So I'm looking for a system. So this is only 2D, but they're looking with the soft tissue. The first one on the video was overlapping the facial and the intraoral camera to the CBCT. The second image was talking about overlapping 2D smile design with gingival morphology and concentrating on the gingiva in comparison with the bone volume that they want to add. So I'm looking for something even going further where you can also design and mill your final restoration based on these. What we have actually in our clinics is the following. You will have a smile design program that you have done. Okay, you show it to the technician just by showing the mobile or showing the image to the technician. The technician will understand how it is, and they begin doing the wax up. The CBCT is also separate as another set. So you have a smile design on your mobile or software or laptop or whatever. You have a CBCT on your computer in the clinic. You will have casts here, and you will have a milling machine here that's doing the CAD-CAM. Everything is separate. I want something combining all of these and combining the benefits of each one. It needs a lot of experience to do that mentally. If there was a software that combines these together, I'd be happy if you would let me know where those systems are and how we can reach them, because I'm aiming that my students will communicate with companies. I'm telling you, communicate with the companies, sales representatives, try to find such systems, and I will ask them kindly to come and give us a demo on how they do the procedure, or we will do a site visit where we can see these combinations, because everything now is driven digitally driven, and the discrepancy between the actual state of art that we are at and the textbooks is huge now. There is a huge gap between what is written in textbooks and what you have on the actual technical advanced technologies procedures. So I want to bridge this gap by such teaching methodology. Thank you.